Glioblastoma is an aggressive brain cancer with few effective treatment options available, but researchers at Banner MD Anderson Cancer Center are moving to phase 2 of a clinical trial that uses the patient's own tumor cells to create a personalized immunotherapy. To learn more, we welcome Dr. Ramya Tadapatri. She's neuro-oncologist and principal investigator with Banner MD Anderson Cancer Center. And we also welcome Dr. Joseph Georges, neurosurgeon and longtime researcher in immunotherapy development, and he's also with Banner MD Anderson. Good to have you both here. Thank you so much for joining us. Dr. Tadapatri, we'll start with you. Glioblastoma, I mean, we all know John McCain, and we all know that it's really aggressive, and it just seems like it's something, it's almost like, you know, it seems like there's not a lot in the way of development. Why is that? Why is it so hard to treat?
Yeah, so it's a great question. And so with any type of cancer, the tumor can be pretty smart. It mutates around the treatments that we give, and glioblastoma especially can become resistant to many therapies. With the brain, there's the added challenge of we have this blood-brain barrier. And naturally, your immune system is designed to go after the cancer, but this barrier can limit your body's ability to send your immune cells in there. So that poses another challenge.
Is early detection a big part of treating here, or is that not as important here than it is with other cancers?
So the one thing that's helpful with early detection is we ideally want to try and catch the tumor before it grows to the point of causing neurological symptoms. Yeah. Because unfortunately, with a lot of our treatments, we are not able to meaningfully shrink the tumor. So once a patient develops these neurological symptoms, it can be difficult to reverse.
Interesting. Dr. Georges, again, it sounds like you guys are in phase, when you say phase 2 of a trial, what does that mean? How's that different from phase 1?
Phase 1 is primarily designed to look at safety, and phase 2 starts looking more at efficacy. So if we start seeing some promising results in phase 1, phase 2 is designed to see if that's really the case and if it's really working.
So it sounds like it was relatively safe here to move forward. Talk to us about this. It sounds like it sounds like immunotherapy. You're basically using the tumor and finding out how to treat it.
Yeah, it's very exciting work. So our immune system has cells that can detect and attack cancer cells. Unfortunately, with glioblastoma, it's very good at tricking the immune system and hiding from it so that our own body can't fight it. I got involved with this particular line of work 12 years ago working with Dr. William Decker from Baylor College of Medicine. Together, we developed the phase 1 clinical trial and just saw very promising results. It was overall safe at multiple doses, and we started seeing patients survive much longer than expected.
Okay, was that a bit of a surprise? I mean, what were you expecting here?
Having done a lot of research, it was very surprising because a lot of times you do a lot of work and in the end things don't turn out as you hope that they would or you think that they would. But in this case, we started seeing patients live far longer than expected, and I started seeing MRIs from some of these patients where the tumor looked like it was melting away.
Wow.
Literally 18 months and even longer, almost 24 months after diagnosis, I was looking at MRIs and there wasn't even a sign of tumor anymore for some of these patients.
You know, for years, Doctor, we've been talking about immunotherapies here, sometimes success stories, and we don't hear anything for a while. Is this similar to immunotherapy regarding other cancers?
So immunotherapy it's a very broad term. So it's really just using your immune system to fight the cancer. There are a lot of different ways of doing that. One other type is CAR T-cell therapy.
Yes. Yes, talk to us about that.
Yeah. So with CAR T-cell therapy, the one major difference is that there's a specific target that we train the immune cells to go after. And so it's worked very well in things like leukemia or lymphoma where we have that one target, that one molecule, protein on the cancer cell. But another challenge with glioblastoma is it's a very heterogeneous tumor. So it's very difficult to identify that one target to go after.
Interesting.
So with this approach, we don't have to find that one target because the immune system is trained to respond to the whole tumor.
The immune system, with immunotherapy in general, but this in particular, when the immune system is targeting this, is it messing other things up at the same time? How do you keep that from happening?
No, the immune system is smart enough with this vaccine that it's not attacking normal cells. It is attacking the full complement of tumor antigens, though. So in comparison to the CAR T therapy, where it may be targeting one or two antigens, this vaccine is made from the patient's tumor, and it encompasses the full complement of tumor antigens. So we're targeting multiple cell types within the tumor.
So this phase 2 trial, how long will this take?
Roughly 2 to 3 years.
How long did phase 1 take?
Phase 1 took just over 2 years.
Okay, so you're still, it's a couple of years to figure out whether, but I mean, it seems like you're on the right track here, huh?
It appears to be. It's
Yeah.
very exciting right now, but we've enrolled 23 patients so far nationwide for phase 2, and we're looking forward to see what the results will be.
Yeah, and I have to ask you real quickly before we go, are you encouraged? Are you optimistic about this?
Yes, very excited about this. Average survivals, even with standard treatment, is typically in the span of 12 to 14 months. With some personalized approaches, second-line off-label therapies, we might be able to push that a little closer to 2 years. But and Dr. Georges can speak to seeing much or better survival so far.
We'll have to ask him back for that because we're running out of time. But it's good to have you both here, and congratulations on this.
Thank you
This
so
is
much.
really very encouraging. Dr. Tadapatri and Dr. Georges from Banner MD Anderson Cancer Center. Thank you both.
Thank you for
Thank you
having
so
us.
much.